Hi, I'm Dr. Suvarchala. I'm the Scientific Director at Ziva Fertility Centers. One of the important tests that we recommend for assessing female infertility is the tubal examination. So when we see that the periods are regular, she's ovulating well, her endometrium is good, and her hormonal levels are up to the mark, we need to understand why she's not getting pregnant, and one of the major causes could also be tubal blockages. How do we perform this? The first line of investigation, the first investigation that we carry out is HSG, hysterosalpingogram. You need to understand that it's a very simple procedure where a very thin tube is passed into the uterus and dye is left into the endometrium. Now this dye passes through the tubes and comes out on either side of the fallopian tubes. If both sides are open, the dye comes out on either side and it is captured on an X-ray film. So this is like an X-ray film, and it's read also like an X-ray film where we look which side is open and which side is not. So both the sides are open, we call it bilaterally patent, means they are open, and probably tubal factor is not the cause for infertility. Then if one side is open, unilaterally patent, so only one side is open or unilaterally blocked. Now what happens with single side blockage is that your chance of success has decreased by 50%, isn't it? That side is blocked, and if the ovary on the blocked side is having an egg which is growing, that's going to ovulate, that side is blocked, not going to get pregnant when there is egg growth on the side that has a blocked tube. Your chance of success has come down by half. So this side which is open is the only chance of your pregnancy. That side, the ovary, if it is able to make an egg and it is released and captured into the tube, then you get pregnant. So you need to understand definitely why the HSG is performed. You need to understand what kind of tubal blockages are there. What could be causing the tubal blockage? It could be a previous surgery, it could be a previous ectopic pregnancy that was cleared out, it could be an infection, it could be tuberculosis, it could be endometriosis where the endometrial tissue is growing inside the tubes itself. So there could be many causes. There could be genetic causes where you were born without that side of the tube or both tubes at all. So that could be one of the causes as well. What are the solutions to it? So like I said, if you are less than 30 and you have a unilateral tube, as in one side is functioning, you could still try naturally, but with follicular studies. If you are able to see that the tube that is open, that side the egg is growing, then you can definitely try on your own or go for a procedure called IUI, intrauterine insemination. So that's a very interesting procedure, follicular study, where we examine the growth of the egg by ultrasonography and allow you to try on your own or come for IUIs. Now what happens if both the sides are blocked? Well, trying on your own or intrauterine insemination, IUI, will not work for you. You need to go for IVF. Because both sides are blocked, we bypass the necessity of the tubes and directly go for the ovaries, get the eggs out of them and make a baby in the lab. Of course, it's a much exhaustive procedure. I have concised it, but IVF is the only solution when you have bilateral tubal blockage. However, let me be quick to add that it could be rectified by a laparoscopic procedure where under the guidance of laparoscopy these blockages can be removed and the patient can still try for a natural pregnancy or with an IUI for a couple of months and then go for an IVF if all else fails. So this is about tubal blockage. I'm sure you have a lot of doubts. I'm sure you want to consult us if you are suffering from tubal blockages, whether it is uni or bilateral as well. Please feel free to contact us. The numbers that you see on the screen directly land to our centers. You can also leave a comment on the comment section. Thank you so much.